The recovery time for butt lift is actually reasonably quick. So what you got to think about the Brazilian butt lift or augmentation using fat is it's like major liposuction. That's all it is. And inserting fat into the buttock hurts a little bit, but most of the ache and recovery comes from all body liposuction, because you got to get enough reservoir of fat to inject into the butt, because you're going to lose some of it. So then you end up reshaping the whole body. So patients receiving essentially whole body liposuction. You know, when it comes to the buttock, I don't, and my training and when I started in practice, I did a few of them, and there were a lot of issues with the body implants I found, except breasts, obviously. I do a lot of them and it works well. But in particular in the lower body, I wasn't very comfortable with the use of implants. So basically the biggest problems with that surgery of the buttock is a region. It's got a strange blood supply and it's close to, obviously, not a clean part of the body. So infection is an issue, extrusion of the implant is an issue, pain, chronic pain is an issue, and if that doesn't happen long-term visibility of the implant is a huge issue, because typically the girl who gets a buttock implant is very thin, as opposed to the Brazilian butt lift where girls are quite robust and they have a lot of fat that a surgeon can play around with. So if a thin girl gets an implant, it's like a breast implant even, you can see the edge of it a lot more than you can see a breast implant. And essentially the girl is confined to wearing jeans, because as soon as she gets into a bikini, you can see the outline of the implant, which is quite embarrassing. Yeah, wherever they choose, but like typically has to be the waist, because without defining the waist, the bum doesn't look good. So bum usually is like a square, and the surgeon has to sculpt it and sculpt the waist and the thighs, and not take too much out of the outer thigh, because you want to create an hourglass figure, because girls who typically want to have BBL aren't thin girls anyway, so they are curvy and they need to obviously embrace the curviness. Yeah, so those areas of the waist and inner thigh are very important, and front, my biggest reservoir of fat is the anterior thigh, so I need girls who have a lot of fat around the thigh to get the amount of liposuction to a good amount, so we can harvest the fat, wash it down so it's nice and, you know, the way we clean the fat, get the blood out, so it's like a nice fat for injection, so it increases the take of the fat. And some girls go for the abdomen region or arms, but usually they're not fantastic reservoirs of fat. It's the back area and the front of the thighs. Yeah, I think you've got to be very careful with cellulite. I think cellulite, a lot of it is pre-existing, so I normally map the body and explain to the patients about cellulite and the fact that it may worsen after liposuction, it may not. It definitely is technique-driven, but sometimes cellulite is something that is obviously genetics and it will stay with the patient. So we talk about cellulite a lot, so if there's a huge amount of cellulite, I just don't like to do liposuction. So the Brazilian butt lift is tied with my knowledge of liposuction. If you need to do a good Brazilian butt lift, you would have had done a lot of liposuction, because the flaws and the problems will come from liposuction. There's inherent problems with the actual injection of the fat, but the liposuction, because it's so extensive, if it's rippled, patients left with cellulite, excess skin, stretch marks, all those issues that can come from bad liposuction can take away from the result of your BBL, because you're taking fat. The advantage of it is you're taking your own body's fat, but the disadvantage is you can potentially damage some other part of the body in trying to achieve a more beautiful bum. Now, nobody would accept that. No patient was going to accept to have a more beautiful buttock, but ripply, uneven legs. So the process is not as simple as opening an implant and handing it to the surgeon. It's a biological implant. Fat is a biological implant, and it gets harvested over a prolonged period of time, because one of the issues we have is making people understand that a breast augmentation takes 50 minutes and a buttock reshaping and BBL takes 5 hours, and hence the costing. Not really. I don't ever take more than 5 litres, which is fine internationally and in Australia. I mean, the days of 10-12 litres of fat liposuction are gone. I don't do mega liposuction. Only reasoning is I don't have big patients, because we screen them only for their own sake. If I operate on someone who needs 12 litres of liposuction, I personally think that's unethical, because that person needs a dietitian. So our patients are very fit. The girl we did a few days ago, she's fit, goes to the gym 5 days a week, perfect diet, just has disproportionately large legs, genetic, and she wants it redistributed. So we take that fat and redistribute it, so we make it more even, more curvy, more sexy. So a lot of the principles of BBL comes from knowledge of liposuction. So if you're a newcomer, you've got to know your liposuction back to front. Then there's particular areas of expertise when it comes to actual fat injection, fat harvesting, fat injection, which is very unique to BBL. But like 80% of the physical work is doing laborious liposuction, curving the body, curving the thighs. It's not a straight up and down, creating curves. So that's like 80% of your work, and then 20% is processing. 10% of that's done by the nursing staff. So the process of injecting the fat is 10% of my work. But yeah, 80% of my work has been behind the scene lipoing. If you watch my Snapchats, I'm lipoing for hours and doing it slowly so they don't get unevenness. And going back to the gym, all body reshaping procedures, you've got to go back to the gym, keep your diet, because you can lose it. And I don't think there's any other operation in plastic surgery that does need so much more aftercare than big amount of liposuction plus fat grafting, because if you don't stick to your diet, you lose your shape, you lose your boundaries, then you've almost done this operation for nothing. So it does depend on a lot of factors. So it's a completely different concept of using an implant augmentation anywhere in the body, where you just make an incision, you open a pocket and you put an implant, and person goes to the gym or doesn't go to the gym, doesn't really matter. Here we're using a biological implant and using aspect of the liposuction, plus the skin has to retract. That's the other concept. For a BBL patient to look amazing, there's a few criteria. One is good fat harvest, good liposuction technique, good method, but also in a motivated patient that has very good skin texturing and contractibility. If the skin doesn't retract, you get a big bump and a very floppy skin. So again, it comes back to the concept, you've got to select your patient. If you think that skin's not going to retract because of what you said, cellulite or other factors, then you just have to dismiss that patient, just say, look, I can't help you. I think generally speaking, the younger person will do well because of the skin, but also I think conceptually, like, I don't think a 40 plus got the concept of the bigger butt, because it's more of a younger person, so it's trending. My 45, 50-year-old patient would just laugh at the fact that the bum's going to get bigger, because all their life they've thought big bumps are not in, especially in Australian culture. There's a lot of negative connotation of having a big butt. So it's more of a Latin American sort of movement, African American movement, which is sipped to the younger girls through hip hop music and popular culture. And having said that, I did a 47-year-old who wanted it done, and the week before we did a mummy makeover. So a lot of the mummy makeovers, we do what we call mini BBL. Just take a little bit of fat and just make them neutral. So have a bum which is deflated and just take them to neutral. So it's really a buttock reshaping as opposed to augmentation. So we don't take them beyond the envelope of the thing. Just it's like the analogy of putting small implants in someone's breast, which they become neutral. So they're deflated, and I'm doing a lot of that. I'm just saying, look, the fat's going to come off and it's going to go in the bin. Do you want me to just put it back so you just plump, not augmented? And we're getting a lot of positive feedback in those patients. We kind of think, oh, well, I'm under the anesthetic and he's taking the fat and it's just going to go straight out. And that fat is, in some women, there's not a huge supply, and once you get rid of it, you've got rid of it. Or you're going to get it replaced with this scar tissue down the track, and they come back in 4 years' time and say, I'm now ready, Dr. Tavakoli, let's do the BBL. I was like, wait, I'm going to go back in the field of scar tissue. And that's why repeat offenders of liposuction aren't the best candidates. And I think this operation really does well, more than any other operation, again, the first operation. So a youngish person, 18 to sort of 40 is a prime candidate, motivated, has got a typically a disproportionate lower body to upper body, genetics, familial, cultural, and they are the ones that can benefit from redistribution of the fat. Look, there's zillions of garments on the market, and especially in America, this, that, and cushions, and I just kind of feel you've got to keep it off it, and just have a compression garment. I just don't think there's anything more is required. Just what typically we've used in liposuction surgery for the past 10 years. I think that's what we use. We don't have a particular BBL garment, we just use liposuction.